finding out more about the wellness clinic that keeps everyone on their feet moving. I'm Debbie Pearson with the Wellness Committee, and I'd like to welcome everyone here. If you have a cell phone, please turn it off. If you need headphones or a big print evaluation, just raise your hand and we will help you with that. We have an interesting person, part of our Wellness Committee, who is handing out evaluations today. Her name is Tracy. Has everyone met Tracy? Who has met Tracy? Oh, so she's already getting around. Well, she's in the back, and I would love everyone to meet her sometime today while we're here. I was just talking about Tracy, who took Robin's place, and I asked how things are going, and Ann told me Tracy must have been a cheerleader in her former life. Were you? You were. Okay. She probably would not have shared that with us, and when you do your next talk, we'll find out something more about you that you might not have shared, but we're so glad to have you here. And today, I don't need to introduce Ann or Kathy. Is there anyone here who doesn't know Ann or Kathy? Okay. Well, guess what Ann just did? It's requiring some paperwork and some sign-up. What do you think just happened to Ann?
No. She's getting married again.
She is not getting married.
No.
She just turned 65. Happy birthday. And so now she gets to sign up for her Medicare, and she'll just be in the same boat as all the rest of us, just the young one of the rest of us. And then Kathy was busy talking, so I didn't get a lot of stuff on her. But Ann tells me that she is quite fabulous in taking care of her grandson, and she might bring him to the Halloween party.
Yep.
What's his name?
Benjamin.
Benjamin. Y'all look for Benjamin.
6.
And, oh, he's 6?
Yes.
Oh, he's a big boy.
No, he's really small.
He's small, okay. The small 6-year-old Benjamin. They have brought some wonderful handouts about the wellness clinic, and there's some piece of it that you won't know. So if you take it home and review over it, there are lots of interesting things like the transition of care and the chronic care management if you're trying to juggle several illnesses at the same time that aren't going to go away, how they can help you with that. But every time we do this, someone learns something about the wellness clinic. I keep trying to say wellness committee, but the wellness clinic that you don't know. So let's give Ann and Kathy a warm welcome.
Thank you, Debbie. It's always so lovely to be introduced by somebody so gracious. Well, thank everybody for coming up. I'll try to keep you awake. I know that we've just finished our lunch and it's kind of nice and comfy in here and cool. All right, so I think we'll try to keep questions to the end, if you guys don't mind. And we've got the other microphone, so we'll be able to hear questions as well. So, okay. So we're going to talk about various aspects or various services in the clinic. We're going to talk about the general, what do we do? What are we here for? What's our day-to-day bread and butter? A little bit of information about nurse practitioners, with Kathy and I both are nurse practitioners, and how that differs from nurses, how it differs from doctors, physician's assistants, other providers you might have had experience with. And then we're going to talk a little bit about the program that we've started, we've joined up. It's a Medicare program called Chronic Care Management, and we'll explain that as well. So, like I said, our bread and butter is kind of acute services. So you might think of coming to us when you would think of going to an urgent care clinic. So something like a cold or allergies, or you're not sure, or is it COVID, is it the flu? So we do testing for those things, and we also are able to treat you for those things and follow you in your course of illness. We see a lot of falls and skin tears and wounds and people. I saw 2 people this morning that had kind of stumbled and had swollen ankles. So lots of things like that, kind of musculoskeletal or skin things. Also see people for, you've been having pain in your right hip or your left knee and it's getting worse. So we can see you for things like that. Then sort of gastrointestinal illnesses. Sometimes that kind of sweeps through, or sometimes there's just 1 or 2 people that have nausea or vomiting, or they're having trouble, and we see people for those kinds of things too. We can do a lot of testing to try to diagnose, and then we can do treatment for those things. More chronic kinds of things like shortness of breath. I'm having a hard time walking as far as I used to walk. I'm having to stop and rest, and I used to be able to get all the way down to the bistro, and now I have to take a break. So that's something new, and that's something that we can help dig into with your history and do some testing, examination, and find out what's going on and how can we help get you back healthy. So things like shortness of breath, or your legs start swelling. We see a lot of dizziness. It's a pretty common problem, and it can be caused by lots of different things, but if it's something that you're suffering from, we can certainly see you for that. And then sometimes they're just, I don't have the energy I used to have. I'm just not able to do the things I used to do. I just don't feel like myself. So we see a lot of that. We talk to people about that, try to do testing, try to look at all your medicines, try to look back at your history, who else are you seeing, talk to you about all of that, about your family medical history, and try to get you feeling better. So we also see a lot of folks with chronic conditions. Like Debbie was talking about, this is something that you've got that the medical system helps you manage, but it's not going to go away. So this is something like high blood pressure or hypertension, or asthma or COPD, which stands for chronic obstructive pulmonary or lung disease. Things like heart problems, like congestive heart failure, or CHF, or AFib, which is atrial fibrillation. Other kinds of heart problems, like needing a pacemaker. Not that we can do that in the clinic, but we see people with problems with their pulse. And then things like arthritis as well. We talked a little bit about that. You've got kind of chronic ache. It's starting to impair what you're able to do. You can't do the things you used to do, what you'd like to do, because of pain in a joint. So we work with people about that. We do a lot of interfacing. So we do a lot of connecting with other services. So we have a lot of services here at Westminster that we can refer to. So the therapy department that's here at Westminster, Select Rehab, and has got the big therapy gym, we can refer to them for speech therapy, which can be very helpful for organization of thoughts or memory problems. We also can refer for physical therapy, and then occupational therapy, which is sort of day-to-day activities of living. If you'd like to have someone come into your apartment and look and see, do I need another grab bar? Or where should I put the new grab bar I'm gonna buy? Or do I need to take up some of the rugs because this might be a risk for me to fall? The occupational therapist, that's one of their services, is they can come into your apartment and look around and recommend some changes that might keep you healthier. We also can order home health. Here at Westminster, we have a very close relationship with a particular home health agency, but we can refer you to any home health agency. And that's when you need some care in your home. You'll need something sort of ongoing for a period of time. You'll need more than just being able to come to the clinic. So we can order that. And then we can also help you get appointments to specialty services, like a dermatologist, or a cardiologist, or a rheumatologist. So we are familiar with a lot of providers in the area, and we're able to call them and try to get you an appointment and send you if you need some specialty care. And we do a lot of what's called continuity of care. So that means trying to make a smooth transition from one place of caregiving, like a hospital, to another place, like coming back to your apartment. So to make sure that everything that the folks in the hospital said you needed, did you need a new medicine? Did you need some physical therapy? Something like that. We follow up after you come back from a hospital or an emergency room visit. I know a lot of times when people come back from the emergency room, they're surprised that the nurse practitioner from the clinic will call and say, can you come down to the clinic to see us? Or can I come up and see you in your apartment? And it's because we like to know what happened and how you're doing and make sure that you've got everything you need, that we're giving you a good continuity of care. So that also happens if you spend any time in rehab or the healthcare center. If you have surgery and you need to spend some time in the arbor, when you get out of the arbor and come back to your independent living apartment, we will come and see you, go over your medicines, maybe something has changed, and just make sure that you've got everything you need. We also do a lot of follow-up with your chronic conditions. If you come in because your blood pressure has been a little higher than normal, we can adjust your medicines, and then we'll follow up. Make sure that, okay, we need to see you in 10 days. We need to make sure that your new medicine is working. And if we need to check any kind of lab work, we need to schedule that and can do that as well. All right, I think we're to Kathy's part of the presentation.
Okay, so, did you change the page? Not yet. There we go. So other things that we do in the clinic. We do ear cleaning. We do a lot of that. Anybody who wears hearing aids tends to need the wax taken out of their ears every 3 to 6 months because your hearing aids work better. Even a little bit of wax sometimes can make your hearing aids not sit correctly in your ear canal, and then you can't hear as well. So, and even if you don't wear hearing aids, some people just make a lot of wax. Sometimes you just can't hear and look in your ears and there's no wax at all and you have an ear infection. So we do a lot of ear stuff. The audiologist here likes to check your hearing without wax in the way. So a lot of times if you have an appointment with the audiologist, people will come see us like the week before to make sure that the wax is all cleaned out so she can get a good reading on your hearing. Because you don't want her putting hearing aids in if you just had wax in your ear, and your hearing's fine without the wax. So we do a lot of that too. We do lab work as part of our regular visits. If somebody's not feeling well, we need to check labs. We do lab work for that. We also do labs for other providers. We get a lot of orders, especially from the in-house doctors, Dr. Pellegrini and Dr. Kroll. We also get people who are bringing the orders from their outside doctors, and we're able to do those labs here, so you don't have to go out and do a fasting lab at 7:30 in the morning or whatever. And we'll send it to your provider. We also will send it to multiple providers if you want, and we will keep a copy of it in your chart here. So if you do want to take it to your doctor just in case, because a lot of times we send it but it doesn't quite make it to the chart in time, you can just come up and pick up a copy too and take it to your doctor. So our lab that we use is LabCore, and it is a send out, but we send lab work every day except the weekend. We are able to do EKGs in the clinic. We can order mobile x-rays to come to your apartment if you're sick. If you have like a cough or shortness of breath and you want to do a chest x-ray, we can do that. If you fell and your arm is swollen and we think it might be broken, we can have them come up and do an x-ray in your apartment to diagnose that you do have a fracture, and then we can set you up with an orthopedist follow-up. Now, if it's something that might require surgery, then we would send you to the ER, but we are able to do the x-rays here. Ultrasounds we can also do here by mobile x-ray. MRIs and CTs we can schedule, but of course we don't have one here. But we can help you. If we think you need a CT, we can help set that up for whatever you need a CT for. We have prescriptive authority, so we are able to treat most illnesses. There's a few things we can't do, like the heavy-duty narcotics, so those things we don't do, but we do pretty much antibiotics, blood pressure medication, anti-inflammatory stuff. We can do any of that other stuff to treat you for whatever is going on with you. We do a lot of injections. We do B12. We help some people with diabetes medication. Some people are in weekly shots, and they're not comfortable giving them to themselves, and so we can help with that. We have some people that take some, they're called disease-modifying drugs for things like rheumatoid arthritis or some of the other autoimmune diseases. They have a weekly injection too, and we also help with those. We do allergy shots, so if anybody gets allergy shots out and they have to go out once a week, or I have somebody who's going twice a week, we're able to do allergy shots here. We just have to coordinate with your allergist, and they give us a flow sheet, and we just follow that, and we let them know if anybody's having a bad reaction, and the flow sheet tells us exactly what dose to give you. And then we also have done testosterone shots for people too. We do flu shot clinic. Most of you probably went to that. We still have some flu shots left. If anybody missed the clinic and still needs a flu shot, you can just drop into the clinic and Yachty can get you a flu shot for this year. We can order pneumonia shots and shingles shots. We get them from Terrytown, they deliver them, and then your insurance pays for the pneumonia shot itself or the shingles shot itself, and then we just have an administration fee that usually your insurance will pay for that too, because you can't get the shot without being administered. So we could do those. The only thing we don't do is RSV and COVID because of the storage requirements for it. We don't have the ability to store the way that it needs to be stored. So those two, you do have to go outside to get those two. But as you know, Terrytown comes in and does a COVID booster clinic every 6 months or so, and they will usually bring RSV with them. So if you want to wait for that, you can. And RSV is only every other year. And we don't know about COVID yet, how it's going to end up. All right, so nurse practitioners. We are registered nurses, but we have advanced training in a specialty. So both Ann and I are family nurse practitioners. You can get certified in geriatrics, you can get certified adult, you can get pediatric, or you can specialize in like psychiatric or cardiology or whatever. But both of us are family, so we kind of know a little bit about everything, I guess. But not a lot about some things. But we've both been NPs for a long time, so, have a little bit of experience. We collaborate with physicians. Our supervising physician in the clinic is Michael Pellegrini, so he's our direct collaborating doctor. We also call, y'all's PCP. If we have an acute change of condition and we're worried about somebody, we'll just call your doctor directly. We write prescriptions, order tests, diagnose and treat illness. We have state licenses and national certifications. And of course, we're CPR certified. And we're kind of similar to a physician assistant, except our training's a little bit different, but we're all called mid-level providers. And so seeing an PA or an NP, you probably wouldn't really notice a difference as far as the care they provide. All right, so how do we work? We do a history, an exam. We just come up with a diagnosis or decide what we need to do to try to diagnose and rule out things and figure out what's going on. And then once we figure out what the diagnosis is, we'll do a treatment. We communicate with other providers, unless it's something silly like a little skin tear on your arm. Your doctor probably doesn't really care that we're going to put a Band-Aid on it. But if it's something like you have pneumonia or some change of condition or acute illness, we will notify your regular doctor. Mostly we see people in the clinic, but we also will go to apartments if you're not feeling well. We won't make you come down if you're super dizzy and you can't even walk. We're not going to make you come down to the clinic. We will come up and see you, or if we think you have COVID, sometimes we'll come up and see you in your apartment so you don't spread it. But so we do make house calls. And then, like when we had COVID, we did do a little bit of telemedicine. We could do that if we have to. Mostly we just make a lot of follow-up phone calls after we see you just to check in and see how you're doing. And sometimes that will be a phone call. We don't always make you come back to the clinic, but sometimes we do. That's the follow-up care. All right, so we have a program that we started, December? About December, kind of-ish? Beginning of the year, we'll just say that. It's called Chronic Care Management. And what is Chronic Care Management? It is a non-face-to-face service, so that it's not coming into the clinic to see us. This is not face-to-face, provided by Medicare patients with 2 or more significant medical conditions. Now, you probably know almost every person in this facility has at least 2 things wrong with them. So most people can qualify for this program, but it has to be expected to last at least 12 months or for the life of the patient. So if you have any chronic, like high blood pressure, diabetes, heart disease, those are not going to go away in a couple of months. They're going to be with you, and so that qualifies you for the program. The services included in chronic care management, the idea is to increase communication, to get on top of things earlier, hopefully keep you out of the hospital if possible, coordinate with all your other care providers as soon as possible to keep you well and healthy and staying in your apartment. So there's increased communication with the patient. We talk to family members, other providers, and coordinate care. I mean, we do some of this anyway, but if you're on the chronic care management, it's more specified, and we do a care plan. We do medication and condition teaching. The best thing about this program is it gives you 24/7 access to a provider. So we are on call, even at 3 in the morning on a Saturday. I know it would be nice if the clinic was open on the weekend, but if you're on the chronic care management program, you can at least call somebody, and we can do a lot of stuff over the phone. We can't do everything, but we can do a lot of stuff just to keep you, out of trouble until Monday when we get here, or the next day, or whatever. We can order medications over the phone. We can call other providers. There's a lot of stuff we can do. We will develop a care plan for your chronic conditions that we're addressing, and we'll update it as needed as new things come up or things are resolved or we have to do more about a certain condition. Like, let's say you have AFib and you've had 2 ablations and now they decided they need to do another ablation and a pacemaker. So we would change it from just AFib and add the other diagnosis. So we change it as we need to. The benefits of chronic care management. I kind of said some of this already, but increases communication between you and your medical provider. So like Ann and I, we each have like a patient load. If one of us is out, we'll cover for each other's patients. Our medical assistant may call just to check in to see how you're doing. So it could be any of the providers in the clinic. It involves you and your care by better understanding of your condition and how to stay healthy. So we'll usually give you specific things to keep an eye out for. Like if you have heart failure, we'll tell you, call us if you gain more than 3 pounds. Call us if you're short of breath. Call us if your legs are more swollen. We'll give you specific things to look for so that you can say, oh, I kind of remember that on my sheet. And you go and look, oh, I'm supposed to call. I gained 4 pounds. I'm supposed to call. So, you know, even if it's Friday night at 7 o'clock and you didn't look at it till then, you can call that number and we can figure out what to do. 24/7 access to medical care by phone. Hopefully you can avoid the hospital by identifying issues sooner and identify and resolve possible problems with more frequent contact. So I've had, when I did this a couple years ago, I did this program, and I would have people that would call them, say, how are you doing? Oh, I'm fine, okay, and I started asking them specific questions. Oh, well, yeah, my legs are really swollen. Oh, well, yeah, I've been getting really short of breath going to the bathroom. But they didn't even think to call you. And so we've made a visit and gone and checked on them, and they were having a heart failure exacerbation. We got them on some diuretics and took care of it and kept them out of the hospital. So we try to make weekly, or we don't always get to do it, but we try to make weekly phone calls where we just check in with you and just ask these questions and make sure you're doing okay. Just in case you didn't think about it, or you're not paying as much attention, or you didn't want to bother us. I hear that a lot. I don't want to bother you. The idea is to bother us. All right. The other things we're doing, and you may have had these before, it's called a Medicare annual wellness visit. A Medicare wellness visit focuses on maintaining health and preventing illness. So if you probably hear us say those things already. Prevent illness and injury by assessing your risk and recommending interventions. So this is different from your annual physical. When you go to the doctor and he listens to everything and does all your labs and goes over all your chronic conditions. This is more preventive stuff, like have you had your mammogram? Have you had your bone density? Have you had all your vaccines? I mean, your doctor sometimes will do some of this, but this is like a 5 or 6 page thing that we have you fill out just to make sure you're up to date on everything to keep you healthy as much as possible. Medicare pays for this once a year. Some of the primary care doctors do it and some don't because it is a little bit time consuming. So if you decide you want to do this, we can check if your doctor has done it or not. We do not address medical problems at the visit. So if you come in and you go, oh, I want you to look at my ankle, that's not what the visit is for. You can schedule a separate visit for that. But if you come in and we do your vitals and your blood pressure is 190/80, we are not going to send you away because it's not part of the visit. We are still going to address it. But it will be 2 separate charges, one for the Medicare wellness visit and then one for the acute issue, the high blood pressure or whatever. But the visit really isn't for the chronic stuff unless it's something urgent. We will require you answer a medical history form and health habits questionnaire prior to the visit. So if you schedule a Medicare wellness visit, we will give you this questionnaire ahead of time. You can go home, take your time filling it out, and bring it in so that we can review it with you. Let's see. It does not include a physical exam, except vital signs, unless something comes up during the visit that's urgent. It's covered by Medicare, and there's no copay, coinsurance, or deductible required for these visits. And like I said, if an urgent medical problem is identified at the visit, it will be addressed but billed separately. And I think I said this too. You may have been done by your PCP unless you have an in-house doctor. If you have Pellegrini or Dr. Kroll, they do not do these because they are time-consuming. So if either of those 2 doctors are your doctor, you can have a wellness visit. They have not done any of those. If you have a different outside doctor, but you're still interested in the visit, we can check with your primary care doctor and see if you've had one or not. Sometimes they do a lot during the physical assessment, so it seems like you've had it, but you really haven't had the full comprehensive assessment. All right, so what do you do if you're interested in having an annual wellness visit? You can call the clinic and get on a list. We're still setting up the computer part of this, and so we haven't quite started doing them yet, but if you go on the list, as soon as we're up and ready, we'll call you and schedule you to have an annual wellness visit. We also have some staff training, because some of this our medical assistant is going to help us with the data entry, and so we have to train her too. So hopefully, at the latest, by the beginning of the year, we will be able to start doing the Medicare annual wellness visits. Okay, so that's it. Anybody have any questions?
Well, isn't it your annual, something is picked up, can, instead of having to go back periodically to have, say, blood pressure checked or lab run, can you pick up on and then send that information to the BCP?
Yeah. Yeah, we have people come in, their PCP says, come get your blood pressure checked for 2 weeks. So they stop by the clinic, We check their blood pressure, we put it on a little card and send it with them. And then they can either call their doctor with the results, or we will send it to their doctor to review. But that doesn't require an appointment, but if your blood pressure is really high or really slow, low, we're gonna address it. We're not just gonna send you home and wait for the 2 weeks of checking. We're gonna do something about the blood pressure, but we do that. And labs, we do send them to the doctor. If you wanna come to the clinic and get your lab instead of having to go out, we'll draw it for you, send the results, and then, like I said, you can have a copy. Any other questions?
In other words, we can I could check early for the 27th and go ahead and send it to the endocrinologist as a separate one.
Yeah.
But you were running up in close, then maybe, the fasting one, then we'll just have to see what we can work in.
I usually tell people, if you come and do your labs and it's less than a week till your appointment, come and get a copy and bring it just in case. Because sometimes it's sitting in their fax inbox and it hasn't quite made it to your chart. But if you hand carry a copy, they're gonna have the results and they can talk about it during the visit. Because, it's nice to have all this electronic stuff, but like practices like Capital Medical, they have 12 doctors in there. I can't imagine how many faxes they get a day. They must get hundreds and hundreds and hundreds. So I'm sure there's somebody that works on that, but it might be hard to get it to where it needs to go by the time of your appointment. So, any other questions?
Wellness visit, Connie's told me though that there's some that don't do much and they just really hit a charge.
Those usually, yeah, that is a problem. Sometimes
What is the
doctors will
question?
charge for it. He said, so basically he was saying sometimes the providers will charge you for an annual wellness visit, but they don't really do what you're supposed to do. They just put it as part of the physical, and then they'll charge the physical charge and the annual wellness charge, but they don't take the time to go through all the stuff like they're supposed to. That does happen sometimes. So the best way to do these visits is to do it separate. It's not supposed to be part of your physical. It's supposed to be a separate thing that addresses all the preventive services.
That's okay, I'll get with you with it.
All right.
But when we get back to this, I think by the Thursday we can probably.
Yeah, well, you know where we are. Just come by the clinic.
Yep.
Okay.
All the-
Any other questions?
I have one.
Hello.
Since they're not reimbursing for telemed anymore, how are you guys doing that?
Well, we don't do it really very often. What we usually do is call people just to follow up, and then we schedule a visit if they need it. Chronic care management does pay for the phone calls. So if you're on chronic care management, it's part of the service. We bill if it's 20 minutes or more per month that we've spent doing something with you non-face-to-face. But, telemedicine is more like an urgent thing. Like if it was a weekend and we decided to have telemedicine services, I don't know how they're doing it now. But, we have done it before. We're not doing it right now. So you're right. They don't want to pay for it.
So this morning, I saw somebody whose daughter lives in another state, and what we did was just put her on speakerphone. So it's not really telemedicine visit, but we're able to provide that.
Well, the patient was there in front of you, right? Yeah, the patient was there, so that's really an in-person visit with the patient. You just have that person, on the phone who wants to hear everything instead of being in person. All right, any other questions?
Nothing?
Okay.
Oh, wait, we got one.
Bentley has a question.
Would you just say what you said about the cost of the care management?
So chronic care management is billed in 20-minute increments. It is covered by Medicare. If we only talk to you for 10 minutes in a month, we're not going to bill anything. It has to be 20 minutes or more. So, the first time we're setting up the care plan and stuff, usually that first month we'll get the 20 minutes, but there might be some other months where we call you and you're like, I'm perfectly fine, nothing's going on. It's like a 1-minute phone call. So then we wouldn't bill it. It's only if it's 20 minutes or more.
I would just like to say I'm a nurse practitioner, and I have seen both of these young ladies, and they are super. One thing about a nurse practitioner, different from a physician, although people like to talk about my doctor, is that nurse practitioners tend to be much more thorough than the doctors are. And so if you're looking at a problem and you know it's a problem and he knows it's a problem and it kind of gets pushed off to the side, that is not the way these nurse practitioners take care of things. So I would just like to give a heads up cheer for the work that they're doing, because as another nurse practitioner, I'm very impressed.
Thank you very much. Yeah, they're wonderful, and we're blessed to have a wellness clinic that does what they do, and it has the tenure that what they do. Because when you walk in, they already know you, and they know the baseline, and they know that if it's a change, it's not what you usually have, because they know you. So we're very fortunate. Thank you so much for sharing this with us. If anyone didn't get a copy of their handout, does anyone need another copy? Or we all got them? Okay. All right. Thank you so much. Thank you.
Thank you, everybody, for coming.
Yeah.